Hi, I'm Kate Wallace.
And I'm Katie Kellum.
We're speaking to you today from the lands of the Lenape people. We're excited to share with you some of our findings from a paper titled Provider and Caregiver Perspectives on Telehealth Assessments for Autism Spectrum Disorder in Young Children, a multi-method DBP-NET study exploring equity, which was published in the Journal of Developmental and Behavioral Pediatrics. Given the rapid shift to telehealth that occurred in the spring of 2020 at the height of the COVID-19 pandemic, including in developmental and behavioral pediatrics, we were interested in understanding the experiences of both clinicians and caregivers who participated in autism assessments for young children through telehealth. In this study, we surveyed 13 DBP clinicians and 22 caregivers who participated in telehealth assessments for children up to age 5 across 4 national DBP practices. From that group, we then interviewed 12 DBP clinicians and 14 caregivers to better understand their experiences, including their perceptions of the acceptability, benefits, and concerns of conducting these assessments by virtual means while children and families were in their own homes. Generally, we found that all DBP clinicians and the majority of caregivers reported high acceptance of and satisfaction with telehealth for autism assessments. It was clear that both providers and families want the option for telehealth care in the future. Both groups reported that they felt that particular components of the visit, such as history taking, feedback, and some follow-up care, are really well suited to telehealth. Qualitative interviews helped us understand more nuance regarding these perceptions and experiences. Katie will discuss some of the themes that emerged from the data with respect to quality, access, and equity of care.
First, both providers and caregivers appreciated that having the child at home improved the physician's ability to observe usual behaviors. However, some families questioned the accuracy of an assessment where the provider was not able to physically assess the patient. Some providers feel that some diagnoses are more difficult to make no matter what. Families noted also that the importance of having a private space to speak candidly about their child without the child present. Some providers felt that telehealth enabled parents to be engaged in the assessment and understand better what the provider was observing. This occurred when clinicians asked caregivers to complete certain tasks to see how the child responded. Some clinicians shared that diagnostic criteria on their screens and walked the families through it. However, families needed adequate preparation before discussing diagnoses. Given some of the behavioral concerns of children presenting for DBP care, there are also some unique benefits of telehealth for the patients and their families by avoiding stressful travel and clinic visits. Families noted that telehealth visits also decreased the costs of seeking care and that telehealth improved geographic access. The usability of the telehealth platform itself was cited by some as a potential barrier to access. Additionally, families with less access to and familiarity with technology generally faced barriers to care. In particular, directions and platforms tended to be available only in English, so families speaking other languages had more difficulties navigating technology. Certain family characteristics may make telehealth less comfortable or feasible, including families experiencing housing insecurity, those who don't have a private or quiet space, those who have multiple children also made it harder or less likely for a caregiver to choose to participate in telehealth. Providers also clearly shared that families with a preferred language other than English experienced additional barriers affecting access and quality of care. In surveys, providers felt less confident assessing and diagnosing children who grow up in a household where a language other than English is spoken.
In all, our study adds some nuance to our understanding of the perceptions and experiences of DBP clinicians and family who engaged in telehealth-based assessments for autism. Based on the information that our informants shared about their experiences, our paper includes some recommendations for considering telehealth delivery moving forward. As we emerge from the COVID-19 public health emergency, it will be very important that we are thoughtful about how we continue to deploy telehealth and that we ensure that we optimize our telehealth usage and processes to promote equity.